As everyone enters, we're going to go ahead and have everyone enter on mute, but as we participate, please know that you can unmute yourself to participate in the conversation. You're welcome to be on camera as well. As well, we have a number of individuals joining us today. We really are aiming for this to be a really interactive conversation as well. I think we're going to wait just one more minute and then we'll get started.
Decided it was going to work.
Good afternoon, everyone, and thank you for joining the Build Initiative's webinar series, Home-Based Childcare, Delivering Relationship-Based Supports. And today we're so happy to be joined by Juliet Bromer and John Korfmacher, as well as Myra Acevedo. As we get started, we want to once again remind everyone that we're entering on mute, but that as we get going, we'll have some polls and some chances to connect. When we use the connection format, we're going to ask that you share out for one another, and just give a sense of where you are in the stream today. And during those opportunities, we don't necessarily have an answer or a solution, but it's really a chance to connect with one another and hear where everyone is in today. So as we get started, we're going to look at relationship-based approaches, as well as, and sort of a background and basis in those, as well as how some new research on measuring relationship-based support for home-based childcare. And then finally, we'll hear from what that looks like in action. And then we'll close out our session. This is an opportunity to connect, and we want to just check in with everyone and either use the chat box or the come off of mute and just let us know what are some of the relationship-based supports that you have found successful or helpful in your work in early childhood and in home-based childcare in particular. And can you make use of the chat box? No. We see that some have been doing regular check-ins with their providers and Family Child Care Network, having monthly meetings, social media, and sharing resources and updates. I'll pause for a minute again to allow you to unmute if anyone would like to take that opportunity to speak. Let's see. Some great strategies in the chat box. Monthly meetings and resource posting, time on Zoom to discuss challenges has been helpful. Thank you. Well, let's take a look at what we mean by relationship-based approach. We're looking that they're strength-based and they build on the provider's knowledge, strengths, and interests. They're responsive to the provider's perspectives, circumstances, and needs, which some of these in the chat box are echoing that. They offer emotional support and encouragement for what can also often be an isolating and lonely field. Ensure provider confidentiality, are culturally sensitive, encourage two-way communication and feedback among network staff and providers, and also emphasize problem solving and information sharing. To hear more on some exciting new research that is being developed by Dr. Bromer and Dr. Korfmacher, we'd like to invite them to come off of mute.
Hi there.
Hi.
Hello.
Welcome, Julia. Welcome,
Thank you.
John.
Thanks, Danielle. So, hi, everyone. I'm really excited to be on this Zoom call with all of you today and see some old friends on the participant list, so it's exciting. So I guess I want to, so John and I are both researchers at the Erikson Institute. John is on faculty there and teaches graduate students, and I've been engaged in research on home-based childcare for many years at Erikson. And John and I work together because we are really interested in what we can learn from, John is a researcher on home visiting, and we've done a lot of work together thinking about the overlap of what is effective support in home visiting and how that might help us in the home-based childcare world. So, but before I start with this new resource that we've developed, I want to acknowledge up front that this work that I'm going to present was done pre-COVID-19, obviously. And so many of the assumptions in this work are based on in-person relationships between agencies, specialists, and providers. And so, and I already see it in the chat box, but something we'll need to be thinking about moving forward is, what does relationship-based practice look like when you can't be together? So I'm not going to be directly addressing that, but it just seemed important to say that, since so much of this was based on the visits and the coaching that happens in person in providers' homes. So John and I are going to share some tools that we have recently developed. They are not yet available, but they will be soon. We're very excited. Tools to help agencies such as networks assess the quality of relationship-based supports to home-based childcare providers. We know that relationship-based supports have the potential to make support effective in improving quality of care for children and families. The work we're going to talk about is based on a comprehensive literature review that we did a few years ago and a conceptual model that helped us develop these sort of essential components of what we think need to be in a relationship-based support to make it effective. We don't have data on effectiveness, but we think this is a start of just defining what is relationship-based support and how might you assess it. The purpose of these measures and indicators were field tested with staff specialists across the country and providers. This was part of a broader study that we are completing as a national study of family childcare networks that has many other components, and this was one part of that. The purpose of these tools are to help networks and other support organizations examine the quality of support they offer to providers and to look at the fit between agency support and the experiences of providers who receive the support, to inform continuous quality improvement efforts at the agency level, and to increase the responsiveness and fit between services and provider strengths, interests, needs, and circumstances. Next slide. Thanks, Danielle. So in our measurement tool, which really consists of, it has two, well, I'm going to tell you, but it has two components, one for providers and one for a survey, a self-assessment survey for providers and one for specialists. But there's really three, we use a framework of three broad components that research suggests are necessary for effective service delivery. And that is knowledge, attitudes, and practices. So knowledge refers here to how much an agency or an agency specialist knows about the providers that are being served. Knows and understands their strengths, their circumstances, their interests, their needs. And it also refers to how comfortable and forthcoming providers may feel around sharing information with an agency that is offering them support. Attitudes refers to the attitudes of the folks who go into homes to offer support, or go into a Zoom call to offer support. So it's really those attitudes that we'll look at in a moment that have to do with respect, appreciation, and non-judgmental stance. Practices, of course, are the specific activities and actions that make up support, the types of information shared, the content of information, and the actual activities that happen during support. Our measures that John and I have developed look at both the perspectives of specialists who deliver support as well as the providers who receive support. So we're really interested in understanding, you know, what are specialists' perceptions of their own work and how they see providers, and then on the other side of that, what does it feel like to get support? What is the experience of receiving support? And so the tools are really meant to help agencies and networks examine the two-way nature of these relationships. So I'm going to turn it over to John, who's going to share some details about the first component, knowledge, and get some of your thinking about this as well. John?
Sure. Hi, can you hear me? I just want to make sure my microphone is working okay. Great. Hi, thanks. Great. Glad to be on this call. So as Juliet noted, relationship-based knowledge is defined very specifically in our model. It is focused on how open care providers are to sharing information with the staff specialists they work with, how much they're willing to share information about themselves, but in turn, how much the staff specialists know about the providers in their caseloads. So having a relationship in which providers are comfortable sharing information about their child care, their home, and themselves, it impacts how specialists can tailor support to meet the individual needs of providers. There is a phrase that I use a lot in my work studying parent support home visiting, and that is that the value in help giving lies in how much the person receiving the help can, first of all, know and understand, and second of all, be known and understood. And these are complementary needs, the needs to know and understand and be known and understood. And in relationship-based work, in order to give knowledge and information that is helpful and useful, one needs to have an understanding of the person and their situation that you're trying to help. So I think that in our measure, relationship-based knowledge in our toolkit is measured with these complementary indicators from both the staff and the provider perspective. So on the staff measure, the provider-specific knowledge, it quantifies how much staff members know about the circumstances of providers in their caseload, knowledge about the child care program schedule, to more personal information such as the provider's cultural values, or even their financial situation. And on the provider measure, we ask the provider how comfortable they are in sharing information about themselves and their circumstances with aspects. And so I think just to kind of extend this conversation, I think we're going to the next slide, or is the poll going to come up, or is the poll on the slide?
We'll launch the poll just
great. So in this poll, we are asking you which of these are most important for the specialist to know in order to develop a responsive specialist-provider relationship, or which of these, if you're a provider, which of these are the most important things that you want to share in order to build a responsive specialist-provider relationship. So what are the important information about that person's practice? And so you can select all that apply. You don't have to pick just one, but just pick the ones that you think are the most important.
And I love, John, what you said about being understood. So I think if you're a provider looking at this list, what are the things that would make you feel understood?
Well, I love these horse race polls because you get to see who's like ahead, who's running up. But then as the numbers come, it's so dramatic. Well, let's just give it a minute because there's a lot of you voting. Now, of course, we're not going to move on until every single one of you has voted. No, we'll give it. So if you've walked away from your computer, we're just going to wait for you to come back. No, let's give it like another 30 seconds, and then we'll stop. But you can, everybody can see the poll results. Is that correct? It's not just me, but providers' culture and values is obviously like a clear winner in this horse race, but that makes a lot of sense, right? But then there's all of these features seem to be are ones that at least like a big chunk of you are responding to. And it looks like the ones that are maybe a little bit more personal are the ones that are less likely to maybe be shared. And so you would want to be thinking about, like, I guess what I read this, I'm really interested, is that, so for example, your maybe your financial situation, you either feel as a specialist is not as important for you to know, or a provider might feel like they're a little bit more hesitant to share health or mental health issues experienced by family members in the provider's home, and then the role that faith and religion play in the provider's home. And I think it's interesting that those are ones that are, you know, but again, like there's nothing nothing seems to be completely off the table, which I think is an important thing to consider when you're thinking about, well, what does it mean to have kind of a mutual supportive relationship? And then I see some comments like it needs to be an equitable relationship. And so there's an interesting question that I was trying to figure out whether to ask about now or we can ask about later in the discussion, but we're talking a lot about what the provider is willing to share with the staff specialist. But you can also turn around and say, is what would providers want to know about the staff specialist? How much of these are things that you would want to know about the person who's providing you with kind of information or support? And I can tell you in home visiting, there is a lot of discussion and debate about how much a home visitor needs to share about their own personal life with the family that they're spending time with. And there isn't a strong answer to that because I think it goes back and forth. And what I've been struck by in the last month in particular is that in the last couple of months with the pandemic and the COVID crisis is home visitors are doing a lot of virtual home visits, and they're doing it from their homes. And there's suddenly, like, there's a window being opened up for families to get like a peek into the life of the home visitors. And I'm wondering if that's also true right now, if specialists are doing any kind of like virtual contact with home-based childcare providers. But we're hearing anecdotally is that the families are really, like, home visitors are reporting they're feeling more connected to the families because the families are recognizing, are seeing, getting a little glimpse into the life of the home visitor, and it makes them feel closer to them.
Mm. It's interesting. There's a comment in the chat box, John, about financial situation being especially important right now during the crisis and with so many folks having to close or staying open, but with reduced enrollment. And I think if you're a network or agency that offers support around business sustainability, then the provider's financial situation is relevant, but it's an interesting comment. Great. So should we move to the next slide?
Yeah, I think, why don't we move on to the next? Okay. I think that's a good idea.
Yeah. There we go.
Great.
And I think I'm turning it over to you, Juliet.
Yes. All right. Hold on. things off my screen. Okay, so the second big component in our toolkit and our model for looking at relationship-based support is attitudes. And the constructs in relationship-based attitudes describe the emotional connections between providers and staff, how providers perceive staff attitudes toward them, and how staff feel about the beliefs that providers may hold. The idea here is that providers who feel that staff specialists are emotionally supportive and encouraging may actually be more likely to accept some guidance around practice. That if you feel that you're held and emotionally supported, you may be able to take a risk in doing something new that you hadn't done before. There are several constructs here that our tool explores and tries to assess. On the provider side, on the right side, there's, you know, to what extent does the provider feel that her specialist or his specialist is non-judgmental, is respectful, appreciates the provider and appreciates not just the provider as a person, but appreciates family childcare or care in the home if it's not, even if it's not licensed. The two of the constructs are measured from the staff perspective only, and those are perspective taking, which examines how much a staff specialist is able to consider the provider's perspective on an issue or topic and take that into account. There are several items here that look at to what extent does the specialist understand a provider's cultural values and practices and how that may shape the way she runs her child care program or caregiving practices. We also look at how comfortable a specialist is with beliefs or practices or values that may differ from her own. So again, this comes back to that idea of like who the specialist is part of the relationship. It's not just that one side it's not the provider has values, but the specialist does too. And so how do those two work together? And how does a specialist manage that or think about that? And then there's an idea that goes across both, which is this idea of emotional connection, appreciation, recognition, respect. Okay, next slide. The third component in our toolkit and our model is practices. So this construct really describes the approach to delivering support, like the activities that take place, the content. There's a lot more on the provider side we look at here. We look at to what extent is the support useful and relevant? Is it useful information? Is it focused on children, families, and the provider's own professional development? Is the support responsive? Does it help them actually solve problems or think about difficult situations they may encounter? Two-way communication is something we looked at. You know, does the provider feel that the specialist listens to her concerns, asks her questions, asks the provider to come up with ideas, not just come in and tell with a checklist or just tell the provider what to do. We've looked at this idea of comfort with support. How comfortable are you having someone come into your home? And that is part of that relationship, is building that sense of comfort. And then goal setting is something we look at across specialists and providers. And goal setting is the idea here is that mutual goal setting, where the specialist and the provider together create goals, that this may facilitate providers making decisions about their practice and about their program and about how to move forward with children and families in their care. It may also help them around sustainability if they feel that they have a good understanding with their specialist about where they're at and what needs to happen next. So I'm gonna stop there and open it up for discussion. We really wanna get your feedback on some of your experiences, whether you are a provider yourself or whether you are someone who supports providers, or maybe you know, are at an administrative level and direct an agency that is supporting providers and you're working with staff who are doing this. What have been your experiences with these three broad components of relationship-based support? knowledge, attitudes, and practices. So we wanted to open it up and just let people share. I see
Hey,
something.
Juliet, while we're waiting for folks to take themselves off mute and maybe share out, we had a great comment from Latanta in the chat about as being a person who sits in both positions, both the staff and the provider, that idea of the validity of a service and not wanting to have your time wasted. And this is something we definitely hear and know from the family child care community when time is so stretched and full. So Latanta, would you want to share more about that, being in both positions?
Sure. Hi, everyone.
Hi.
Yeah, I worked with Juliet on a project in the past, but
Yes.
I am a family provider in Philadelphia. I have a STAR4 program. I've been in operation for over 12 years now. And in the same time, I serve as a coach, a mentor, in partnership or collaboration with some of our local agencies at times like PHMC, First Up, and now our new ELRC is taking on some of those roles. But it's, you know, I hear from providers and I also resonate with the notion of getting services and supports that I need versus agencies just coming and pushing an agenda attached to some grant or whatever it is that is drawing providers in. And so I try to be very cognizant of it because I know what it's like to kind of have that specialist, but I'm not really getting enough out of the support for it to be as beneficial. And it could honestly turn into, you know, not good use of resources. You know, someone else might need a more involved level of services than I've been privy to, especially if I'm serving in the same capacity. Like I'm doing the exact same work. I'm out coaching, mentoring providers as well. So how can I grow in this situation? So that's been my experience now for the past 3 or 4 years.
I wanted to just thank you, Latanta, for sharing that. And I think you also touched on a really something we were thinking bringing up, which is this tension that I think is a tension in the field between monitoring and support, and that idea of so often our support folks have an agenda. They do have an agenda. It comes from their, you know, supervisors or from the system that's funding the network. And often that agenda has to do with monitoring compliance to regulations, to standards, to the food program, to whatever it is that is basically funding the support. And that role is sometimes really not aligned with a support role and with this idea of relationship-based practice. And I'm really struck by that. And many years ago when John and I were first starting on this work, we were looking at a relationship-based training for family child care network coordinators. And I remember one of the coordinators saying, wow, these dimensions, you know, we showed them these dimensions and, oh, this is so great, but I can't do this. It's not my job. It's not part of my job. I can't do I would love to do this, but I can't do this. So I do think that's a big tension that we need to think more about in the field.
Can I say something? This is Yolanda Dean, family child care provider, 5-star rated in Hudson County, Jersey City. And, you know, just listening to what you just said, Juliet, with the monitoring, those that do the monitoring versus those who provide support. I mean, I've recently experienced the disconnect with my license up for renewal in the month of May, which I started the process in January, and due to COVID, everything was put on hold. And so my license had to expire. And, you know, basically it was because I couldn't get all this information requirement for a substitute, which is only probably 5% of my business. And I felt really disheartened because the agencies, they don't connect. I got the same feedback. It's not my job. My support person, Grow New Jersey specialist, I wish I could help Yolanda. Send me an email. I'll talk to my supervisor. It's not my job because the monitoring agency, they're the one that grant the license. So there was no provisions and no streamlining of even trying to temporarily renew my license until I get those other things. And we in a pandemic. Who's going to a doctor? Who's getting fingerprints or whatever? So I find that the support has their hands tied, whereas it's not a union. I feel like there's so many pieces to the puzzle for a provider to get what she needs. And at the end of the day, I felt alone.
Wow. Thank you for sharing that. Yeah, I think there's, in some of the work we did, Latanta in Philadelphia, actually, and I remember there were licensors at one of the meetings we had where they talked about the need for relationship-based approaches in regulatory roles. Like folks who are in that regulatory enforcement role could really benefit from some of these relationship-based approaches, that the two shouldn't necessarily be not compatible. There is a role for relationship-based work even when you are in a role of having to enforce a rule. I don't think we've thought enough about that, or it'd be great to know some licensing agencies that are thinking about that, if there are any.
Well, I also feel that as the provider that has the ins and out of the process should be part of the process. And we're not. It's more like a set of rules. You must do this, 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 and this. And for anybody to go through, QRS and become 5-star rated, they know what they're doing. So not including providers in the process is not getting a more, you will not get a positive result, because the relationship across agencies and interdisciplinary is a disconnect. And I've experienced it firsthand. And honestly, this was really the first time I took a look at my business. And again, it was due to COVID too. And it's just, the support was very, very, I would say, low.
Yeah, thank you for sharing that. One more comment before we move to another question?
Well, Nebraska just shared, and certainly, Michelle, you're welcome to take yourself off mute if you want to share a little bit more about what that's looked like, but in particularly how licensing has been handling visits during COVID-19 and the policies during that period of time, and really supporting that. The network has been supporting that communication with their licensing entity. Has been their example.
Great.
Hi, this is Michelle from Nebraska. I'm speaking on behalf of the Family Child Care Network at NECC, the Nebraska Early Childhood Collaborative. We are an early Head Start partnership that is just dipping into family child care right now. So we're in our infancy in the program, but one of our top priorities is working very closely with licensure. And so, and that's part of why I joined this webinar, because I'm really interested in relationship-based approaches. And we especially wanted that to follow us along into how we're operating alongside licensing. So when COVID happened and we were all forced out of our offices, we made a very intentional move to keep in contact with our licensing department, and just to be up to date all the time about all the different policies, ratios that were changing, the cleaning and sanitizing policies. And we just continuously were sending out like a resource newsletter to our network providers to just constantly keep them up to date about all those changes and where they could find those changes. And I communicated on several occasions with our head of licensing department, just asking her about, how are you doing CPR updates? What can we tell providers about fingerprinting and where can they go. And so we really made an intentional move to just, again, work alongside them and just continuously pass that information on. And I think that's something that we're not seeing across the nation. We're not seeing that partnership with licensing. And so we really have been trying very hard, especially with COVID, to just keep that relationship so we can help our providers and keep supporting them.
Great, thank you. So Danielle, should we turn to our last question before we turn it over to Myra?
Let's go back to our presentation.
I wanted to just, before I ask this question, acknowledge that there was some talk in the chat box about family, friend, and neighbor care. And I know that Bill is thinking about doing a future webinar on that, but you know, as John and I have been developing these measures for agencies that support home-based childcare providers, we have always been thinking about the range of home-based childcare providers. So the majority of the providers we tested the tools with were licensed, but not all. So we did have some family, friend, and neighbor caregivers who responded to the surveys and that we tested it with, and we definitely have agencies who helped us develop it, who serve family, friend, and neighbor care. But it's true, it's not the majority of the folks that we have talked to in developing this have been the regulated sector. But we certainly think that these principles apply to family, friend, and neighbor care. And that's actually why we call it the home-based childcare tool, not a family childcare tool. So, okay, John, do you want to take the lead on this last question?
Yeah, I mean, I think this is something we could easily spend, an hour talking about, but I think we have, 5 minutes? So I want to just open it up for what people here on the call might want to contribute, but either in the chat box or feel free to speak up. But what do you think staff need in terms of training and supervision to engage in these kinds of support relationships? Like, how do you make yourself open to be able to listen and really understand the provider, what they need? How do you, what helps so that specialists can work with providers in a partnership? I heard that word being used a couple of times today, and I think that's a really important concept, is to think about what does it mean, what is a partnership, what is needed to be able to provide that kind of service.
There's a really good comment in the chat box. Yeah, talking that they need to understand that family childcare looks different, runs different, and that they're not creating mini centers. I think we've heard that time.
Yeah. That part of that relationship is that being understood, like that this is not a center, this is what you're walking into. It's really important.
But also that providers will vary quite a bit on their approach and how they think about.
Kevin would just give me money to contribute. So, Keaton, I don't know where he went.
So we're going to ask, if you're not commenting, to go ahead and mute yourself, but we would invite any other comments to come on and hear your voice.
Could I step in for a minute? Can you hear me?
Yeah.
I'm the one that just commented about the staff understanding the difference of family child care. I'm in Arizona, and we have a QIRS system, and early on in our system, we discovered quickly that we had coaches that had center-based experience, but not family child care. So they were going in, and the first thing they wanted to do was to make these little mini centers. And so we had to do a lot of training around that so that people understood family child care looks different, feels different, runs different, is different. And families that are seeking that time of care are looking for that difference as opposed to the center base, the larger things. So for me, that has it just always resonates with me. And whenever I'm meeting family child care, I have to come from a different avenue. I've had personally experience being a family child care and being center-based, so I think for me it's a little bit easier to differentiate and put that family child care hat on. I think for a lot of technical assistant specialists, it's a little bit more challenging. And so I think all the training and support that we can give them to understand that difference. That's it.
Thank you.
Thank you.
Absolutely.
There's a lot of comments here on staff training, on communication and cultural bias, on, here's one.
Yeah, absolutely. I think the communication training is something that that's being talked about a lot in the home visiting world, and it's something that I think lots of people can benefit from. I mean, I'm hearing again, this just reiterates the importance of being able to listen to and really hear what the providers are saying that they need, and it gets back to that kind of the know and understand, and also be known and understood. And the other thing I would add to this, I always feel like I need to bring up when we talk about support and what kinds of support and training is needed. But I also think you always want to be paying attention to both the specialist and the provider's well-being. Home-based childcare is it's hard work. I think especially now, it's really hard work. And I also think providing support to home-based childcare is hard work. And so thinking about your own kind of your own well-being, your own emotional reactions to your work is also really, really crucial.
I'm glad you brought that up, John. I do think that's such an important piece. And someone in the chat box, and I responded to it, was talking, a few people were talking about how staff sometimes needs, they need the support of each other. And what we actually, a while back when we did some research in Chicago, and we heard that some of these network coordinators talked about how isolated they felt in their work. They felt isolated at the agency. Maybe there weren't a lot of people working with family child care. And there's this sort of parallel feeling of isolation. The providers they work with feel isolated, and they themselves as support staff feel isolated. Many of them working out of their cars, right? That car is their office as they're traveling from home to home. This isn't something you do well, no one's in an office right now, but it's just the nature of the work can also be isolating. And so finding ways to, bring people together on both sides seems really important. That well-being piece.
Well, thank you both so much.
Thank you.
We're looking forward. Do we have an idea of when that will be available?
Soon. I hope in the next month. I think I hope in the next month. We're really just in the final phases of getting it produced and ready to share. So if someone wants it sooner, just contact me, and I'm happy to share a draft if you are like rearing to go.
And we're also welcome for your feedback too.
Yes, we'd love any feedback. Please get in touch with us. I think the info is at the end of the slides.
Yes, I was just going to say both the contact information for all of our speakers and hosts will be available at the end of the slide. The tool, when it becomes available, will be on as well on the Build resource page for home-based childcare. And we have another resource directly to the Erikson and the research that John and Juliet have authored thus far, well with some other researchers at the end of this presentation. So thank you again. Well, now we'd like to switch gears just a little bit and explore what relationship-based supports can look like in action. And we're happy to have with us Mayra Acevedo from New Mexico, who runs the Educadores para los Niños del Futuro home-based childcare network. So hi, Mayra, can you go ahead and come off mute?
Yes, hi everyone. Very nice to meet you all via Zoom. Great many of the things that you are all dealing with, I have experience in the last 5 years with Educadores para los Niños del Futuro network here in New Mexico. And I can give a little bit of information if that's okay, Danielle, just to kind of center us
That would be
on
great.
who I am
Absolutely.
and how this work got started. So my name is Mayra Acevedo. I work with a local grassroots nonprofit organization called Partnership for Community Action. We're a local nonprofit and we do work in Albuquerque, New Mexico, really centering our work with our Latino, Spanish-speaking immigrant and refugee population. And we focus in areas of education, economic equity, and health access and wellness. And so this project got started in 2015 when we we had an initiative done looking at family childcare and friends and family care in Albuquerque, and what that looked like and what was missing. And so out of that project, we learned quite a bit about the challenges, the barriers of family childcare, and more importantly, opportunities. And so the network itself was created by providers who either were participating in our child, adult, and care food program, and a few that did receive the subsidies but were only registered and not licensed. And so the project began really having them and centering the providers to understand what were their needs, what were the missing pieces, and we began to collectively form this network that met their needs.
Fantastic. Can you tell us a little bit about or relate an example of about how relationship-based attitudes are put into practice? How you see this piece of the work that John and Juliet just discussed in action? Yeah, so definitely with working with providers, really understanding and getting to know them in a non-judgmental way, meaning that really spending that one-to-one time to know where they're at, to know if they have, are they alone? Are they alone in this country? And were teachers in their communities and had that passion to provide that service to their community, really understanding what are their situations, and also opening up yourselves as for them to know who you are as a person, where your family comes from, really opens up opportunities for you to build that trust that is so much needed. And they get a sense of what are your own goals and why are you asking these questions? Because you want to build a relationship. Being respectful and of where they're at in the process, and helping them see where the missing pieces are. So listening with respect is very important, and really modeling that respect, what that looks like with them is key, because those aspects of relationship building attitudes, they will carry on with other network members themselves as they begin to become those leaders of information that they can share, with other individuals that are interested in childcare and going beyond just childcare. That's one of the things that that has been centered in the network. We're not just babysitters, we're educators, and we deserve as much respect as
a teacher, elementary teacher, an early childhood teacher that has their credentials, because they play an important role in raising our youngest children. And listening to their perspectives, they might have a different way of understanding their role, and beginning to connect them to, connecting them to the different agencies to understand this is your perspective of what you need, you as a provider, but there's other perspectives out there, and really listening in and coming to a consensus in a group. We had to do that over and over again, but really providing that safe space for them to have these healthy conversations. And knowing that we all have different beliefs is going to be key, different religion backgrounds as well, and coming together as a group for one mission, which is providing support to families, ensuring that we're connected, not isolated. Because I think when we're isolated, we're alone. Everything seems more difficult. So being part of a supported network, anything is possible.
Well, Myra, thank you so much. I have a few other questions for you, just from some of the little bits I know about the program, but we have a question in the chat box that I know you may be able to answer. Is your program or the state involved with NAFCC, and if so, how?
Okay, so we are not involved with NAFCC, and again, we started this initiative because we did a project that I allowed us to identify the needs. So it was a survey that was done in 2015, and so when we did this project, we partnered directly with the providers, and we worked with them individually to really form and structure this network. And we began to learn about the different agencies that are part of the early childhood system. And we began to connect, we began to connect providers and are in our nonprofit to developing those relationships with existing departments.
Mm-hmm. Can you give us a snapshot, just a brief snapshot of what it looked like when you began 5 years ago, and what those relationship-based supports have grown to look like today?
Okay, so when we started, we had 11 providers that came together to talk about the possibility of the network. And actually, this wasn't an idea that came from the organization themselves. From the survey, they expressed they wanted to be part of an informal network. And so we had a total of 6 meetings with providers on a Saturday to start talking about, what does this network look like? What does the schedule look like? What are the topics that we need to address? What do we need to know? What are the missing pieces of the puzzle that we're missing? And so the network was established in August of 2015, and with the intention of having monthly meetings for 2 hours on a Saturday, where we would learn about the process of differentiating between the different programs, from becoming a registered program to becoming a licensed home program and a center base. So we began to involve the licensing department, in our cases, Child, Youth, and Families, and which is now transitioning into the Early Childhood Education and Care Department. So we're very excited. On June 1st, we'll have that. So, so very exciting for everybody.
Yeah. Where are you now? How have those 11 participants grown in the past 5 years?
Yes, so we have, our membership is now at 250 providers, and they all come from different, everybody is invited, to be part of the network, even if you're just interested in taking classes. and want to know how to open up your family childcare program. And providers have moved on from being registered to actually owning their own centers, have applied for pre-K funding, have been mentoring each other on how to set up their learning centers, are part of the quality rating improvement system in our state. We have 5-star provider. It's been taking a very long time because one of our barriers is language. In New Mexico, we have a large population of Spanish-speaking community, and our specialists in our state are they're limited in terms of knowing Spanish or being bilingual. So, but we're, with those small little steps that we have been able to make, we also have seen some changes within our department where they are beginning to translate information in other languages, which is a big win. And I think it wouldn't have happened if we weren't proactive and invited them to come in. Because one of the things that we heard from the department was we wanted to work with providers, our Spanish-speaking community, but we didn't know how to. Sometimes we're very technical, and it was mentioned during this, in the earlier session, how we have a task to do, you know, if we are going to annual visits for providers, we have a task to do, and we can only take so many minutes out of the day or so many hours during the day to do so.
Right.
So as this network really allowed to bridge that gap that was missing, and providers now are being invited to be part of advisory councils. We have a board, the network has its own board that takes in and listens to upcoming needs of the network, because it's always evolving.
Yeah. And you mentioned a couple of times some relationships with other entities or the broader early childhood system. So could you share one or two examples of how you use relationship-based practices to engage with the broader early childhood system?
Yes, of course. We have been, one of our, a great thing that happened just last year, and this is a long time working, you know, slowly, is really engaging with our resource and referral. And we had worked with them with providing workshops with providers, helping providers understand or use the tools that are available online to access resources and workshops. And recently, we have an MOU now with the resource and referral, and they work directly with providers and are building relationships more intentionally and are listening to what can be done, how can we better improve the way that we're working with providers. And so that's a way that's one example that we have been able to build. And providers, they don't, one thing I wanted to add quickly is that once you begin connecting providers to these, these departments, and these departments, it really helps them in their own leadership, because now they have a relationship directly with that department, and they feel comfortable to address and address topics, and also ask for resources that they have difficult navigating.
Thank you so much for those examples and sharing what this can look like in practice. I want to circle back to all of our participants, and well, just take a minute before we do that and check in with everyone in attendance and see, how does this resonate with what you're seeing where you are, what you would like to see, other approaches that you've used in relationship building. There's comment that they love the leadership building and the providers taking the lead in the network. And I know, Myra, that's something that you're your network has been really intentional about since the beginning. Can you speak just briefly about that piece of the coaching, the peer coaching that you've implemented from the beginning?
Yeah, so what we have done is been working with them directly on the areas that we know there's gaps. In particular, we created a team that knows how to navigate the licensing process here in our state, and the registration process, and they help others. So even if people are not part of the network, they're sharing and disseminating information, and they're taking on other responsibilities within the network, such as leading and facilitating monthly meetings, being part of meetings that happen within our early childhood sector also.
Fantastic. Well, I'll open the floor again. And as I do, I do want to invite Juliet and John and Myra, any closing thoughts they have on this really rich topic.
I just wanted to add or just comment on this idea of providers, the idea of provider leadership, and not just the idea, but the actual doing that and making that a goal of a support program. I do think that is part of relationship-based practice, right? I mean, there are some items in our tool about, does a provider feel like her voice is heard, or that she's an equal partner, that she has a chance to ask questions back to the agency? Are there two-way pathways for feedback and communication? And so I do think leadership should be like one of the outcomes of relationship-based practice. And this idea that that the decisions shouldn't get made about providers without their input. We shouldn't be deciding things for them or that are done to them, but rather with them and alongside them, and that they really need to be the leader. And I think that we will see, there's low rates of participation by providers in quality improvement systems. Before COVID, there was, a precipitous decline in family child care, and we don't know what it's going to look like after this crisis, but there are a lot of reasons and factors behind that decline. But one small, maybe not so small part of that is our systems do not engage providers as equal. Our systems do not necessarily hear the voices of family child care providers or seek to hear those voices. They don't invite them to the table. So I think it's a bigger issue in our field, actually.
Yeah, I mean, I will just say Juliet and I had the experience of doing a learning collaborative project, which is totally different, and we don't have time to talk about it all, except that it really highlighted to me the value of the provider's voice. And when you give providers opportunities to help kind of drive quality improvement efforts, the ideas that they come up with, the insights they have are so helpful. So I just want to just reiterate what Julia said.
I'm so glad you brought that up, because I think it also makes me think of, it's not just about feeling good, right? It's not just about being nice, and it's not just about a warm and friendly, I listen to you, you listen to me. It has to have content and action in it, right? So like the learning collaborative, it wasn't just like, oh, you're invited to the table and we want to listen to you. It's like, no, you have the knowledge and the skills and the ideas that can move the field forward. And here's a structure for putting it into action. So I think that sometimes when we talk about relationship-based practice, we think it's all about just being nice and warm and friendly. But without any content or like very concrete, specific action behind it, I think it can be empty. And that is I think that's I don't know, unintended consequence, or it's like a pitfall that can happen when we talk too much about relationship-based practices and we forget about, well, what's the content? What are the actions people can take?
Right. And if you think about like a provider's day in their life, if you are making them take time out of their work to come to the table, but then don't actually engage them as a true partner, then in some ways you've wasted your time, you wasted their time, and you haven't helped at all.
Right.
Thank you.
John
Thank
and
you,
Juliet, I had a question
everyone.
for you that actually related a little bit to the meat of doing the work too, from having done some work with family child care networks and providers in communities, the importance, I guess, of somewhat of the parallel process. And I wondered if you could speak to that when you're talking about this idea of what do the staff need to be able to provide this type of support. It's sort of easy to say reflective supervision, but the reality is that there's often an organizational or cultural shift that's needed within the organization that houses the network and the staff, and there's often a disconnect there. We find it in home visiting too, and it's really hard to provide that. Do you have any reflection on that, or have you seen some good examples of what the support needs to look like as the organization that holds the network and supports the specialists or the mentor providers or any of those pieces to really be that sort of support for other family child care providers?
It's such a great question, Gina. And yeah, so we have thought a lot about that. We actually also in our field test tested out some measures around organizational support. There's this idea of psychological safety that's starting to be used more in early childhood around, do you feel safe at your agency taking a risk or, making a mistake or that kind of thing. But in the learning collaborative work that John was talking about, that work really required equal partnerships and true collaboration, and there was a focus from the beginning on equity between providers and staff. And it became clear as we went through this very intensive process with these 8 different agencies that some of them, the organizational culture just wasn't ready to hold these kinds of collaborative equal partnerships. The staff had never done it. They didn't have the support maybe from their supervisors to do it. The hierarchies were so strong and embedded and, in some cases sort of part of cultural hierarchies that exist even broader than early childhood. And so there are these institutional cultures that get in the way of this work, definitely, and we've seen it happen. And then there were those agencies that were really ready to say, let's try something new, let's all be that they had some history of bringing everyone to the table. So I think that's a really important piece.
The chat box is echoing the message of the intentionality behind this. And it has to be action-based. It can't just be a listening session.
Right, and I think if we talk about the parallel process, it's not just we think about like the provider and the specialist, but then it also goes up the chain as well, or it goes to like the supervisor who supports the specialist. It has to do with the kind of the administrative structure. So what kind of supports do they need to engage their agency in relationship-based practice? So it's all kind of embedded in these circles.
I have a question, and I put it in the chat box. I've been a family child care for about 7 going on 8 years, and I've always been taught to be the best in class. So I made sure I got all the credentials in place. And it's with every experience, every work experience, there should be upward mobility, okay? I'm in the state of New Jersey. I'm only allowed to have 5 children. I already reached 5 stars, been accredited, CDA, infant and toddler specialist, and so on. And I've applied for certain leadership positions after having 25 years of banking experience on Wall Street. I pretty much know what I'm doing. And there's never anything, there's no support. And I'm not being negative on this webinar, but I feel like once a good provider, always a good provider, because it makes everything look good and it makes it, the systems that are being put in place, QRS. I'm the only one in Hudson County 5-star rated, okay? I reached my top. So how do I take all the knowledge and skill sets that I have to be a good example, be a mentor, a coach, in a leadership position, to use this to help bridge the gap between other stakeholders and providers? Because at the end of the day, providers are always at the lowest totem pole, but we are so needed and we are so valued. And I have not had that opportunity. I want the opportunity. I reached out to certain stakeholders, certain institutions. I applied for jobs online. And I feel like in any corporation, it's like, stay right there because you make everything look good. And that's what I want to address, that support, and taking such like providers or experienced individuals and say, hey, you know, this is a good candidate. We can use those skill sets. We can use that experience. Where's those opportunities?
Right. We hear you, Yolanda. We really appreciate you being so forthright and sharing your experience, because it does really underscore the disconnect between systems and how things are functioning. And that idea of, there's so much about family childcare is driven by the provider leaders, but it does feel like there is kind of a brick wall that folks hit. And I think that's partly what your question's raising, right? Is this idea of how are our providers supported to not just be a great provider, but also be that leader that's driving the system. And that's some of what I think Danielle and I are both reflecting a little bit on, what we're hearing about from this idea of like, it's not enough just to be nice. We're holding this format and gathering your input because we want you to be co-creators with us in thinking about the real deep system change that needs to occur. And we want to ensure that that includes you all as leading in it, and what that looks like next. And I know we've had a couple conversations now, and so we need to begin to be moving more to that action. I'm really hearing Juliet and John loud and clear about that there has to be action too, and that's really important to us. So we appreciate that you continue to raise these truly kind of foundational issues of how the disconnect between providers and systems. I think it's really important that we're unpacking these things and trying to do something about them. And you've got, there's a lot of folks in the chat that see and feel the same thing, so.
Yeah.
And I was just gonna say, like, I invite that fire you have, Yolanda, to, you know, come together as other providers. I'm sure that you have a network. Come together and strategize and continue to have those conversations. Even with the zoning department, if you want to expand your business, how can you talk to your city, talk to your county, and talk about how do we move these, how can we change those regulations and zoning code? Because that's what we had to do as part of the network. We brought those conversations forward because that was a big barrier. We were able to push that envelope. And so, you know, invite you to not give up, to keep knocking on doors, come together and organize with your community.
I think also, Yolanda, what you're pointing out is like, we don't have we don't have good, where does family childcare fit into career lattices that the field has developed, right? Like sometimes they're not even, family childcare providers they can't even see themselves in that career lattice, or they're at like the bottom of it and there's no way to get to the top. And I think we really need to rethink even the way our professional development systems are structured to include.
Yeah, the opportunity, all I'm saying is that it's individual, and the opportunity should be there. And even if a provider does not go forward, the support person or whoever, you know, is there working with that provider should see those skill sets and maybe make recommendations, even if it's volunteering. I'm just saying that the opportunity should be there. And I'm not one to be pigeonholed. I like stepping stones, so I build on it. So I took my banking career, entrepreneur, early childhood educator, and build on that. And a lot of things that's being discussed, I can truly see where the gap is and maybe make recommendations that will help bridge the gap. That's all I'm saying, that providers is one thing and we care for the children and a home-based business. I'm all for it. but at the same time, where's the other opportunities to step out of that?
Right, there was one more. I know Danielle's going to do a little bit of wrap up, but to echo that, Yolanda, also in the chat, is this idea that providers shouldn't have to leave their program to be raised up as a leader. And that's something that we're really committed to, is that idea of leadership and driving the change that needs to occur from the seat of being a provider, or if providers want to move on to other positions within the system, there should be, Juliet's spot on, the career lattices don't speak to these types of things, for certainly not for family child care, and even for other center-based providers. It's really sort of not, it's about the staying a teacher career lattice, it's not about the rest of the system and field. There's a disconnect, certainly.
And we certainly need to think about, if we're going to have you know, pathways to coaching, to moving into leadership positions while maintaining your family child care program. Think about all the supports that are needed: sub-care, qualified assistants who earn a living wage, benefits, all the things you need if you are going to if you do want to move into a leadership role and you don't want to completely give up your business. How do you do that?
I think this has left us with some really great feedback and fantastic comments. Another wonderful conversation that really thought-provoking. We are going to need to go ahead and close out time, and we want to thank Myra and Juliet and John for their time and input. We have everyone's contact information here, and here are the resources that we discussed. In the coming weeks, we're going to continue these. In the coming weeks, we're going to continue these conversations with supporting home-based childcare through addressing comprehensive services, and then looking ahead, states looking ahead, infrastructure for home-based childcare. We'll take a look at how states are thinking about this in their PDG applications. As we mentioned on the last session, BUILD has opened QRIS this year for registration. Registration is limited to 300 individuals per session, but we wanted to suggest some sessions that as of this morning were still open for the upcoming July 20 for 20 QRIS sessions that may be of interest to home-based childcare systems and providers. So with that, thank everyone for their time today. We look forward to hearing from individuals next time. Gina, do you have any final thoughts?
No, thank you all. I apologize that I wasn't able to be with you for the first half hour. It sounds like it was a good discussion and some sharing. So thank you for continuing to partner with us around this. And thank you to Myra and John and Juliet for joining us this afternoon as well.
Thank you so much.
Thank you.
Be well.
Likewise. Thank you.
Thank you, everyone.
Danielle, do you want to go back to the resources slide? There was a request for it.
Yes, absolutely.
While we
and the PowerPoint presentation as well as the recording will be available at this first resource, the home-based childcare resource page for BUILD. The recordings from the other sessions that we've had, as well as a bevy of resources that Juliet, John, and Tony Porter and others have developed over the years.
Danielle, do you want us to stay on for a sec?
We just like to keep the chat open. Sometimes there's folks that are still trying to communicate in the chat. So we leave the chat open for a few minutes. No, but you're welcome to ring off, Juliet. Thanks.
Okay,
thank you.
Thank you both so much.
Nice to meet
Sure.
you.
Thank you, Myra.
Bye-bye.
Good to see you.
Nice to meet you.